then, you might have to use creams, lotions, even harsh chemicals. But now, heat is becoming the beauty tool of the future.
The FotoFacial. You guys might remember this one. About a year ago, we did a story on it. It claims to diminish wrinkles. But this new machine, the new FotoFacial, will diminish your wrinkles by 65%. Oh my gosh.
Well, for years, doctors have used lasers to remove the effects of sun damage on the skin. But now, move over lasers. There's a new treatment on the block. Kathleen Riley reports on how this might revolutionize skin care.
Saturday, Hub City.
New millennium and new skin technology. We're back with Dr. Steve Mulholland and Chrissy. Dr. Mulholland, what are we doing today?
What we're going to be doing is using some very high-tech technology to address some of the skin problems that people develop, either from age, time, sun exposure, very fine wrinkles. We can use techniques called pulsed light therapy or photofacial to build up collagen under those wrinkles. Pigmentation changes in the face, hyperpigmentation, sun blotches, and some of the vascular blemishes, the little spiders, are all treated with a photofacial as well. And we blend that with some microdermabrasion and some other techniques that we'll talk about, and over a period of time you see a really nice vitality and a youthful appearance to the skin with really no surgical intervention.
Okay, Chrissy, are you ready?
Ready for that new year, new skin.
Dr. Mulholland, this is microdermabrasion. What's that used for?
Well, what Dawn is expertly applying now are little tiny crystals passed across the skin. They take off the very outer dead layer of our skin, that very sallowed, aged appearance to the skin. And that in itself will help smoothen very fine wrinkles, take some of the pigment out, help with pores and textural irregularities. But more importantly, it also removes that dead outer layer so that the photofacial treatment, the pulsed light, can get down to where it needs to work to remove spiders and brown spots and beef up wrinkles. Okay, Patrick, what I'm doing now, I'm putting the photofacial handpiece and filter down on the cooling gel. And that cooling gel is just used to cool the skin and make it comfortable. We don't need any freezing. We don't need any anesthetics or numbing cream. This is all you need. And we're going to see an intense pulse light. That pulse light is going down deep under the skin and stimulating the formation of collagen. People really have to understand how new this is. Yes, you can do resurfacing, you can do any other type of chemical peel, but you'll have a lot of downtime. You'll have redness, you'll have pinkness, you'll have skin that you need to clean and look after, and you must take time off work to do that. This is a new technology that says we're not even going to touch the outer surface of your skin, we're going to send the pulse light deep to the undercarpet of the skin and actually produce collagen. Between 10 and 30% more over a few weeks. We're also going to fade the blemishes, the spiders, and the brown spots while we're there. So Chrissy, your pulsed light photofacial treatment's almost done for today. Next time, you'll be coming back and you'll be doing some microdermabrasion and a little oxygen treatment in between.
Does it hurt? Does it hurt, Steve?
Well, the first part of the treatment is alternating. 1 week is the microdermabrasion, and that feels great. There's really no pain with that.
Yeah.
The pulse light feels like an elastic band snapping on your skin. No one's ever said, stop, I can't tolerate this anymore.
Okay.
And the nice thing is you feel, wow, I must be getting some burn or something to my skin. But
you feel like something is happening.
And you stand up and you look in the mirror and there's nothing, because it's all gone right through the outer layer, epidermis, to the deep layer, and that's where we stimulate certain cells to produce your own collagen.
So instead of putting those collagen injections in, we're producing our own.
Exactly. We are taking light energy with specific features to that energy and turning on the production of collagen, which of course, as you know, dissipates as we age. And it's about an 8-week treatment. It's not something you're going to see, wow, 1 week I look so much more vital.
Fantastic.
But over 6 to 8 weeks, about 80% of the clients that I've developed this technique with have commented on a noticeable and significant improvement in their skin.
Do you do a before shot? Do you take a little Polaroid so they can see the differences?
Yeah, we digitize their face before, and then we take a digital image at the end of the 8 weeks, and we ask them to fill out sort of an analog scale of how much improvement they notice.
Okay, before we get to the next part too, how new is this?
This is very new. It's a lot of this technology really isn't even approved in the States for this utilization. The actual wavelength and the pulse light lasers are approved, but where I've taken this is beyond what is certainly accepted in the FDA, but Health Protection Branch in Canada, it is.
Is they okay with this? Okay. All right, we're going to take a look at the rest of Chrissy's treatment right now. Let's do that. Very interesting.
Dr. Mulholland, we're several sessions into the program. What's next?
We've used the crystal peel to smoothen out some of the wrinkles, textural irregularities, some of the pores. We've come from below with the FotoFacial and the pulsed light to build up collagen. So what we're going to do today is, at this point in the treatment, often hydration is important to the skin, bringing back some of the moisture content. And Dawn will be taking Chrissy through an oxygen facial.
So what is the oxygen mask?
The oxygen mask is almost the finishing touch of a treatment that's designed to help hydrate the skin after these microdermabrasion and photofacial treatments so that you get the optimum in rejuvenation. What I've done is I've applied serums to Chrissy's skin to hydrate and penetrate deeply into the skin. I'm now ensuring that that happens by putting this mask on. It'll stay on for about 15 minutes. Patrick, now that we've taken off Chrissy's mask, we're going to begin the deep penetration of the product into her skin. What this is a double oxygen treatment. What that means is I'm using the serums that are oxygen-based to hydrate her skin and propelling them into her skin by use of oxygen gas. In the winter, we need this. We dehydrate, which means we lose water in our skin almost continuously with the central heating, the cold weather.
We're going to finish off with an injectable to help with the things that gravity create, the deep furrows on the smile lines, corners of the mouth. And Articol is what we're going to use today. It's one of the newest injectables, recently approved about 5 months ago. And the nice thing about Articol, unlike collagen or Hyloform, it lasts. First of all, Chrissy has been frozen. That's why there's a little bit of puffiness to the skin. But although this might look painful, there's absolutely no pain or discomfort whatsoever on the part of the client during this phase. And then these little beads of polymethacrylate, which is the Articol, are deposited under the skin, and they stimulate collagen production. And that's a beautiful thing because the collagen beefs up the furrow or the wrinkle and creates a much softer look.
Well, Dr. Mulholland, we're done.
We are. Chrissy's completed her course of treatment, and I've noticed a real improvement in a lot of the areas that bothered her. The fine lines across the forehead and the fine lines or crow's feet of the eyes are much improved. There were a lot of blemishes, if you recall, of the cheeks and broken blood vessels and sunspots of the upper cheek, and they've all blended very nicely. So overall, there's been an improvement in the vitality and the harmony of her skin. It looks much more youthful and vital. And from this point on, just some basic skincare, toner, cleanser, and perhaps coming in every 3 months for a touch-up, microdermabrasion and a photofacial, and she can maintain this vitality for a long time.
Oh, Chrissy, you look great. And I'm not just saying that because you're my boss.
Yes, you are, Patrick.
Oh, butter up, you look great, huh? The session that she has to go in what, 6 months, is only like a 135-minute session. That's it. It's not like another 8-week plan.
It's not the whole package and process. It's just one microdermabrasion and pulsed light treatment.
Okay, now here's the thing. Who would you not recommend this to? Because there's some people that will want to sign up for this right away thinking, hey, this is great. This is a great alternative to actually, going under the knife. But you're saying what?
Well, we really do inform our clients well. This is not for people with bags, sags, and droops. It's not going to reverse gravity, but it will reverse a lot of the superficial components of aging. The pigmentation from sun, the photoaging it's called, the broken blood vessels, and the fine wrinkles. If you've got deep furrows and crevices, it's not going to help that. But it will help with the superficial components of your skin. So if that's what you're looking to improve, it's a wonderful and new approach for that.
Now, there's a lot of young women that watch the show and, they want to look like the people on the covers of magazines, and that's not somebody that you would do either. I mean, this has to be.
Right. No, they're better for airbrushing and some computer imaging.
All airbrushing, okay? I just want you to know.
But, I must say that for the younger individual that wants some prophylactic strike at early wrinkles, blemishes, sun damage, before this, there was too much downtime for their really problem.
Sure.
This is really an alternative with no downtime. So it is appropriate for young people who have some sign of aging.
Some sign of aging. So once again, the treatments are for 8 weeks, 35-minute sessions, right?
Yes.
And then if you decide to continue with it, once every 6 months for a 35-minute session.
Yeah, about 6 months. Some people may stretch it longer, some every 3 months.
Well, I'm sure other people have questions for you, so we want you to stay on. And any cosmetic surgery question that you might have, give us a call, 416-870-7716 or 1-800-295-LINE. Dr. Steve Mulholland will be back right after this. Stay with us.
In health news today, most people do what they can to prevent wrinkles and premature aging, but seem to forget about the main cause. Christine McPhee has more in this report.
Well, that's life. Brought to you by Herbal Select.
There's a lot of things in life we can appreciate, one of them being fine art or the sun. But too much of the sun can actually crack you up.
One of the newest things to treat sun damage is the use of intense pulse light, or called the FotoFacial. It's just a bright flash of light, like that focuses on the skin, 640 photons all at once, looking for targets. Targets are brown and pink things. Excessive blood vessels, excessive rosacea, or excessive sun discoloration, and it fades them harmoniously, giving you a beautiful tone and texture in your skin.
Cloudy or sunny, we still need protection from the harmful rays of the sun. Well, it looks like rain, liquid sunshine, and we still need protection. Oh well, that's life. You've probably heard all the pros and cons about the sun, but having lots of exposure to the sun can eat up a lot of B vitamins. You also may want to be oiled from the inside out by adding some fatty acids to help your body and moisturize the skin. Enjoy the sun just a little bit at a time.
Christine, are tanning beds, the artificial tanning beds, any safer?
Well, you know what? Tanning companies would probably make you believe that they are safer and a good source of tanning, but studies have shown that there is a relationship between tanning beds and skin cancer. So you know what, Jane, I wouldn't trust any of it.
Now, what about sunscreens? Obviously, that's one way to reduce our exposure to sun.
Right, and you know what? We've got a great show on Friday, so I hope we'll get the viewers to tune in, because we're going to be talking a lot about that on Friday.
You have a lot of new products for people with thinning hair and for children and adults, and so we'll talk about that on Friday. Okay, thanks very much, Christine. Our health and wellness specialist, Christine McPhee. That's our show for today. Thanks for joining us. I'll be back tonight with Lance.
A Toronto cosmetic surgeon calls it boot camp for your skin. The latest technology means you can rejuvenate your face, then go back to work.
Much in the way of pain or discomfort?
None at all.
None at all. Great.
Dr. Stephen Mulholland is using the latest weapon in the anti-aging arsenal. It's called the FotoFacial. His patient, 48-year-old Jean McDonald, wants to turn back the clock on her skin.
I think the photorejuvenation, the FotoFacial specifically, is one of the biggest advances in the last 3 or 4 years, in that we are finally able to harness energy, not cause downtime or recovery, and make the skin look more attractive.
Beautiful skin and no downtime are the two selling points of the FotoFacial, a cosmetic procedure that's gaining popularity. Dr. Mulholland uses 2 different lasers, an intense pulse laser.
And 1, 2, 3, close your eyes.
It works on redness, spider veins, and brown spots, reducing and possibly eliminating them. Next, he uses a neodymium YAG laser.
Now, you're going to feel a little bit of burning and discomfort that lasts a few seconds for this.
This laser works on deeper blood vessels and stimulates collagen to help smooth out wrinkles. Dr. Mulholland says side effects are minimal, some pinkness and temporary swelling. Special goggles are worn to protect the eyes from the laser's flash. There's also a very small risk of darkening or lightening of the skin. But looking good takes time. He recommends a program of 11 visits over an 18-week period. Nor is it cheap. The program runs about $2,000. Dr. Mulholland himself does not perform any of the procedures, but has his nursing staff carry out the full program, not an uncommon practice in some clinics. At the end of the 4 months, Jean McDonald is thrilled with the results.
I looked awake. My skin was so clear I could throw away the makeup. When I had this done, I automatically felt much better about myself.
So if you do this for 4 months, 11 visits, I guess, then how long can you expect that to work for you before you have to turn around and go back?
Well, this is it. The effects are not permanent, and so Dr. Mulholland says you should follow a maintenance program. That means you go for a FotoFacial once every 3 to 6 months. But you know, down the road, Mother Nature eventually will take over.
Yeah, no kidding. Okay, well, thanks, Mary.
Okay.